Good morning, everyone. Dr. Christine Smith back for an interview today that I think you'll find really interesting. This is going to be about postpartum mental health, which I think is often not talked about enough. So I'm going to go ahead and invite on my wonderful friend who specializes in doing postpartum mental health for mothers and just coming through a really that your neurotransmitters are changing, your hormones are changing, your brain is actually going through something called neural pruning, where your neurons are actually shifting and changing as your body is going through these processes, and it can create some really interesting outcomes for people. So hello, Heather, how are you? Thank you so much for joining me.
Hi, thanks for having me. I'm so excited to be here and chat.
Yeah, absolutely. I was just kind of telling people a little bit about what we were going to talk about, and I was going to tell them a little bit about you, but why don't you just tell us a little bit about yourself and how you fell in love with this niche of working with women during this
Yeah,
time?
for sure. So I'm Heather Ratych. I'm a registered social worker and psychotherapist and the owner and clinical director of Bloom Psychotherapy, which is a pretty large now Canada-wide mental health clinic. We specialize in seeing individuals and couples throughout the reproductive, perinatal, and maternal mental health phases of life. And it was actually my own experiences, I think, as it is for many of us in this that work in this sector, of infertility because of severe endometriosis, and then some birth trauma, some pregnancy loss or a pregnancy loss, and then just like a really difficult postpartum transition. I thought, I'm a mental health clinician. I know what to expect. I've got this. And I really struggled with what I now call like high functioning type A personality anxiety postpartum. I thought, because I've got it all together, it felt like, quote unquote, my house is clean, spotless, actually, at that point in time, even if I wasn't sleeping. I'm getting out a lot. I have a big social support network that I must be like, just must be what it feels like to be a new mom. And it took me a long time. It took me 3 babies in 3.5 years to figure out that what I was feeling wasn't normal and that it didn't have to feel that way. And I thought, if I missed this myself as somebody who has 7 years of education in this field, who had a network of colleagues that I was talking to who were like reinforcing this idea that this is like a normal way to feel postpartum, and that mom should just feel like burnt out, exhausted, irritable, angry all the time. If I was missing that, then who else was being missed? And really, as much as I was not feeling great, I did okay. And there's so many people I recognize now that aren't doing okay during that time, that are desperate for support. So it really helped me at that point in time to just pivot my practice. I had worked previously mainly with youth, and I thought, like, there's a gap here. Even though people talk about it, we're really missing it, and people are falling through the cracks. So I kind of dove into all of the research, and I really wanted to offer like just a different approach. I wanted it to be like an approachable service where women and their partners felt like they could just show up and be themselves and be really heard and listened to, and where we didn't minimize what they were feeling and just call it like, this is what it's like to be a mom. So my clinic has grown enormously in the last 4 years, and we really just love kind of diving in with this population and trying to advocate for a more like comprehensive, holistic approach to like holding families during this period of time.
Absolutely. And I know you also train other practitioners for this, because I think this is something that gets missed a lot. Like, I have had family members who have gone through really, really tough postpartum times,
Yeah.
including clients as well. And, one of the things I'll find is people, like, often our common societal response when someone has a baby is, oh my gosh, like, how is the baby? How is everything? How's being a mom? And there's no
Yeah.
question of like, how are you, Heather?
Yeah.
This independent
Absolutely.
human that has been going through a massive change in their life,
Like your
a hormonal change, a
body, your
neurological
relationships.
change, a
Yeah.
neurotransmitter change, your digestion, your organs, like everything.
Yeah.
And so I've come to starting to ask people, like, hi, like, how are you doing postpartum? First and foremost, like, how are you?
Right.
And then I will
Yes.
ask about how the baby's doing.
Yeah.
And because it's that connection, right? And there's that interesting component of this is an extension of yourself. So you're not really separate from it. And, you know, it's interesting. My sister actually just did a whole art series around the perinatal period.
Oh, wow.
And one of the paintings that she has is this mother holding an infant, but they have this floral pattern that they're both wearing. And it's just, you can't really kind of tell where it begins and ends. And it's this representation of that experience
Yeah.
of what it's like. And also your identity's changing because your brain is changing. So I know you're pretty passionate about professionals having extra formal training and working in this realm. I'd love if you could talk a little bit about that and what you view that as and why you think it's so important.
For sure. And I love that image description because I think it so beautifully highlights, we often say like everyone wants to hold the baby, nobody wants to hold the mom. And we also have like our society, we have this strong focus on just being okay. And especially as a new mom, it's like if you say that you're anything but thriving, there's like this either incredible judgment or we don't listen. We don't want to listen to that. So moms get that, and they're like, well, just say that I'm good, or I must be good, or else I'm a bad mom. So I definitely, I feel like perinatal mental health, it's such a precious time period. And there's so much that's happening. Like you talked about, like huge hormonal shifts, like the biggest hormone drop that happens in life in such a short period of time happens at that day 3-ish postpartum. But we don't talk about that. We don't tell moms like, be prepared. That third day, you're going to feel like an entirely different person, and you're not going to understand that. We don't say that. We just say like, it's normal.
And you're dealing with neurotransmitter changes because people forget in order to breastfeed and have the milk letdown reflex, your dopamine has to change. So you don't have as much dopamine when you start breastfeeding. You do have the
Right.
oxytocin component, but like your whole neurochemistry is
It
shifting.
just is. And if it sounds so technical, like scientifically, then imagine what it feels like, right? In somebody's body who has no idea what's actually going on if they've received. I mean, again, people who are reading or researching while they're pregnant, it's almost always around like how to take care of a baby and how to make sure that my birth goes as I want it to go. And we don't really focus on anything else. There's no books. I mean, there are, but that are widely read around like how to care for yourself postpartum. It's like how to be a martyr as a mom instead. So yes, I really, I recognize and acknowledge like postpartum, your entire world is turned upside down hormonally, physically, mentally, emotionally, your relationships, your sleep,
Your
your
schedule,
digestion, as you
your
mentioned, like
routine.
everything as you've known it has completely shifted. And the women during this, like the women that we see or that are needing support during this period, they need it yesterday. So it's such a different, and we can say that for all mental health support, that when people need it, they really need it right now. But perinatal women can't afford to take 6 months to feel better because nothing stops for them. They can't take things off their plate. There isn't space. So they need to be seen yesterday. They need to feel better yesterday. And so I really believe that, we need a comprehensive approach to identifying and understanding the risk factors and how we can all help to educate families who are entering this period of life around sort of what to expect and how to protect themselves, because there are so many things we know, like the research supports that we know can help to make, reduce the risk of experiencing a difficult postpartum transition or a full-blown perinatal mood and anxiety disorder. There's so much that we know about this, but people usually aren't looking at it until they're already feeling awful. And I believe that if all clinicians and practitioners who are involved with women during the childbearing years, because 50% of pregnancies are unplanned. So we can't just say like those who are trying to get pregnant, but really just who are working with women. If we're all really aware of what these early risk factors are, the more subtle signs and symptoms of mood disorders in pregnancy and postpartum, and what the protective factors are, I really think that we can start to shift the landscape and normalize sort of seeking support more quickly. I think people also don't recognize that suicide is the leading cause of death in pregnancy and postpartum. We don't talk about that, but when we talk about, your blood sugar and monitoring for that while you're pregnant, and your blood pressure and all of these other physical things to make sure that a woman's health is okay or being monitored. But most women don't recognize like their suicide risk is so increased. And that really speaks to sort of the need for not even wraparound support, but like anybody who's involved with them really understanding like the complexities of the mental and emotional health journey. And even postpartum, you know, at least 1 in 5 women will experience a perinatal mood and anxiety disorder. That's enormous. And most people aren't diagnosed for many, many, many months. And then we have to wait for treatment to take effect. So the sooner we can identify what's going on, the sooner we can help people to feel better. We can, I believe, reduce the risk of maternal morbidity. We can help, increase mother-infant bonding, which obviously has lifetime positive impacts. We can help relationship dynamics in the family, which benefit everybody clearly, and just show that there's people here who kind of get this, to really normalize. Like, this is a hard time. So yeah, I have really, my practice has really grown. We have 17 clinicians on our team now, all who have specialized training in perinatal mental health and identifying and working with those who are experiencing a mental health disorder during the postpartum and perinatal period. But I also really spend a lot of time offering training and mentorship to clinicians, and not just therapists. Like, I love working with chiropractors and naturopaths and pelvic floor physios and kind of the whole spectrum of anybody that somebody in this period of life might reach out to, because I really feel like the more of us that are sort of aware of what's happening, the better chance everybody has of feeling well during this period.
Well, and then it also helps out, partners who are supporting a partner going through a hard time, because if you are a partner and you're also not getting sleep because there's a new baby around, and you're trying to support someone who's going through like a hormonal, neurochemical, let's just call it like a wormhole, because that's what it can feel
really?
like.
Yeah.
It's a little bit more than just like a transition. Someone who's going through that, trying to support all that as a partner and hold everything by yourself, that's a lot. Yeah. So having some kind of support from you, I think, not only takes the pressure out of the relationship, but fosters the mother in the way that she needs so that she can respond better to baby and better to partner as well. So those things are huge. And like, when you're talking about the difference in training that you really like people to have, it's like the training that you do. Are there other trainings that you advocate for, or just, like, what are you finding are some of the differences that you think people, if they want to work with this population, really need to make sure to have under their belt?
Yeah, for sure. So there are a couple of really great perinatal mental health certification programs that are super comprehensive. Postpartum Support International is a great resource for both practitioners and for our clients. They have tons of resources there for everybody. My program that I created is sort of meant to be for those who aren't going to dive in and specialize only with working with this population, who need like certification and week-long courses and training, but it's more for people who, part of their practice will include this population. So it's meant to just be a sort of a quick deep dive to look at exactly what I mentioned, like risk factors, what the stats really are, how to identify the more subtle signs and symptoms, what to do if a client or a patient that you're working with presents with some of these symptoms, because it's one thing to identify, it's another to have the conversation. And so lots of practitioners say to me, like, I'm not really sure, I'm not really skilled in asking about these more intimate details of their mental health or what's happening for them. I look at sort of the physical piece and some of that emotional piece. So it's how to have those conversations, and then what to do then, like where to refer people to, how to find the right mental health clinician. Because I really believe, I'll just tell you a quick story. I had a client once. This is when I knew that this, our niche was really necessary. I had a new client call me once and say, I'm looking for a therapist. I've been struggling with severe postpartum depression for 8 months. I haven't left my bed, that unwell, not showering, barely eating, not able to physically take care of herself at all. So her and her husband reached out to a therapist who did not specialize in this time of life. And the first thing they were told to do in their very first session, she was told to start as a top priority to prioritize physical intimacy in their relationship. And when she called, something in her said, that doesn't feel right. And when she called me, my mind was blown, because, and this is why I really think there's a need for people, if you're going to work with this population, you just really need to know the intricacies. And so again, there are certification programs available for therapists mainly, but a course like mine, understanding perinatal mood and anxiety disorders, really allows people to just take a quick deep dive. What do I need to know so I can then identify and refer people to the right people?
You can ask the right questions, because I saw a couple comments coming in, and people were saying, like, when we take the baby to the pediatrician, like, why do they not also check on mom? They also need to be checked on. And do OBs and pediatrician know the right questions to ask? And they said, I think not.
Yeah.
And I think it, of course, always depends on the practitioner. Like, some may have done more work and understanding in this realm, but even myself, like, I went ahead and did an entire coursework in perinatal and pediatric health, not because I was planning on having a perinatal pediatric practice entirely, but because I wanted to know exactly what I was doing if they came in.
And
I
thank
wanted
you for doing that.
like, I wanted to know the right things to ask. And just, there's so many nuances to it. And even in that course, I feel like we didn't cover the postpartum period as much. And now that I've seen family members and clients and different people going through it, I think it is one of the most important times, or especially if someone has had to, like, lose or terminate a pregnancy. That's, also kind of a postpartum period in itself. And that's a whole other thing as well, because of the grief that goes with it. So there's so many of these things. But in all of this, I'd love if we could also talk about just kind of your understanding of the shifts that happen in the body and the brain. We kind of touched on it in the beginning, but like neural pruning, which a lot of people don't even know happens, which basically means that your brain starts to change and prune your own neurons, meaning it changes your neurological structure. So your personality and your perception and your understanding of the world permanently changes at a neurological level, because your body is doing these things at the same time that you're going through a huge hormone crash, a neurotransmitter dominance shift so that you can breastfeed. And then if you, like, have trouble breastfeeding, then you're dealing with the turbulence of all of that. And I think this is really challenging, and it's just not talked about enough, and it's not understood enough because of exactly what you said. There's stigma if you're struggling, which is silly, because anyone who's going through this kind of chemical shift in their body, like,
how can you not
there's turbulence. Yeah, how could you not? And and for the women who it's been really smooth for, like, thank goodness. I'm so glad. Good job taking care of yourself. And some people have different genetics. Some people's genetics don't tolerate it as well as others. Some people have other life stressors going on at the time. Some people have dealt with toxin exposures in their past, and it makes their body more sensitive. So there's all of these different variables, but I'd love if you could just talk about your understanding of those and your experience and practice of how it plays into things.
No, I love that. And I love that you mentioned these pieces, because again, it's like this idea of, even though we know, physiologically this is all happening, and we can kind of go, oh my goodness, how can one human go through all of this in such a condensed period of time? The world says, just act, when you're 1 week postpartum, just act like you never had a baby. And it just blows my mind often. So yes, we have all of those physiological pieces, neurological pieces that are happening. And then we also have things that are interplaying, such as, what was your birth like? Did you feel supported? Is there an element of birth trauma there? Is past trauma, childhood or adulthood trauma, resurfacing during this really delicate period of time when our bodies are hypersensitive to everything? What is your support system like, and how does that interplay with all the changes that are actually happening within your body? It's such a complex period. Then we have things that are really common, like the baby blues that happen in this shift, where we have this short-term, temporary, huge hormonal dip that is caused by all of the factors that you just mentioned. And we have people who at 4 months postpartum are told, like, oh, it's just the baby blues. Totally inaccurate, first of all, and then minimizing their experience. And it is healthcare providers who are saying things like this. We've had clients who said their doctors said, this is normal, it's just the baby blues. So when inaccurate information is being spread as well, we have that extra piece on who to trust. People not trusting their own instinct, because they're like, what is this body? What's happening here? The emotional side of all of those pieces around, like, our physical body changes, and how we perceive ourselves, our self-esteem, intrusive thoughts, which we know are really common. Up to 85% of women experience intrusive thoughts in the postpartum period. But again, we're not told that those are normal and to be expected. We're not told why they happen based on our brain chemistry and what's going on. We're just told, like, hide those thoughts because, again, they signify that you're a bad mom. And it's such there's a complex interplay between all of these different pieces that then, makes people present in ways that people aren't really able to understand. Like, we can't look at somebody and go, oh, you have this symptom. What could this be? Because there's just so much that's involved, that makes it just feel so big. And most people during this period don't understand why their emotions feel so big. Is something wrong with me, or what am I doing wrong, or why am I creating this? And then they feel like they're failing. And so much of motherhood is already tied to identity, as we mentioned. So it's, again, speaking to why it's so important for those who are involved to have some kind of awareness of what is normal and how to talk about it to people, to just validate what's going on and explain, sort of scientifically as well. This is why it's not just you.
Yes. And that's why I'm so glad that we're having this conversation, because I think this is just important for people to be able to access so that they can understand these things about their body, so that when they do have those intrusive thoughts, they can be like, oh, this is my chemistry. This is not me. And then they cannot feel like they're failing all the time, which is already like, I don't think anybody really knows how to do motherhood. It's just like you come into it and you figure it out, no matter how many books you've read. And so if you can have some understanding of, like, okay, like, I don't need to listen to that thought. This is my neurochemistry. Like, this is happening. I can expect this. This should, like, and you can give it an in period, right? Okay. If I do this for my neurochemistry, it should be over in a few weeks, or something, or over in this time period, or like working with a practitioner to support if you really are struggling with your chemistry. But I think chemistry is hugely tied to thought processes. So that's why I really love what you do, because if you can start to get the thought processes not so trenched in the negativity that can come, you can actually really shift the chemistry pretty well just from the mental processes alone. And I'm curious, because I know I've run into this with clients and family and friends and all that. For those who had a really tough postpartum and they're like, I don't know if I can have another kid because I don't know if I can go through this again. Can you speak a little bit to anyone who's wanting to have multiple children, but maybe they had a really rough time with this, and how sometimes your chemistry can figure it out as you go along, or just what you've seen in work?
Absolutely. And again, I think I love working with clients like that, who have, we've worked really hard on sort of getting them to feel more supported during their first postpartum period, working through some of the things that have come up for them, and diving into a second pregnancy with them feeling completely different from the beginning. This comes up a lot, and even if things weren't awful during the first postpartum experience, some people will still have this, this thought of, can I actually do all of that again? Because it's a lot.
You're giving over your body entirely.
Your body, your sleep, like your life, all of it, right? And I mean, I do joke with clients, like, there's a reason our brains are really great at helping us to forget the really hard parts. And when we look at our babies, it helps us to really remember why we're doing this. And that's how evolution, has created things, that we do have more children. But realistically, I think, as clients are thinking about or contemplating a second baby, we really reflect back on, how did you feel during the first postpartum period? Not just sort of, did you experience anxiety or transition issues, but did you feel supported? Did you feel like you had people that you could call to vent? Did you feel like you had some strategies in your toolbox for, challenging your intrusive thoughts or difficult thoughts as they come up? How did you manage sleep deprivation? And through that, trying to figure out what the gaps were, not gaps within them, but gaps within their system around them and the family support, and really trying to work through, how do we make sure that you feel differently this time around, and use this time of contemplation of a second pregnancy and then the 9 months of pregnancy to have you feeling like you've got your people, you have your support network, both personal and professional, who to call if you're struggling. You know, we create postpartum plans with our clients, not just birth plans, but postpartum plans. And I say to them, like, even if you never pull this out, at least if you are struggling with breastfeeding or sleep deprivation or your mood, you don't have to spend your time researching. You just pull out your plan that you created when things were feeling good, and everything's there and outlined. You know, who are we going to call? Who's good for this? And really just kind of diving into how do you want to feel differently next time? And let's spend this time creating a wraparound approach that you know exactly what you might need, or you can reflect on what you might need, and you know how you're going to get that. And it really makes a difference. You know, I have a client right now who had a really, really difficult transition with her first pregnancy and was hospitalized, and her risk of experiencing that again is technically about 1 in 2 with a second pregnancy. And it took her some time, but she's ready now to kind of dive into a second pregnancy because she realizes that all of the things that came up for her during that first postpartum period, she's now really been able to address and bring in lots of support around. So going into a second, even if things don't go well, because of biological factors that are already there, all of the other support that she has in place ensure that she's got a plan, right? And so her risk, you know, of relapse is lower. And even if she does, she knows what she's going to do that time around. And that just feels empowering. So it helps us to feel differently.
Well, I think that's huge. And like, it's similar to working with a doula, right? Like coming up with a birth plan and also a plan of like what to do if stuff goes wrong. Because of course you plan for your birth to go ideally, but you don't always plan for that emergency C-section that might need to happen. And then the abdominal surgery that you had, and then you're recovering from birth and abdominal surgery, which is a huge injury to the body. And I remind moms all the time, I'm like, it's okay to take this time to, it's okay to take this time to recover. Like you just incurred a massive injury.
Yeah.
And when we get injured, like our body shifts majorly, our immune system shifts, and it's doing different things. And so like understanding those things, and also having, exactly like you're mentioning, like a contingency plan of like, what do I do if this comes up? What do I do if this comes up? Because then when your brain isn't functioning because your hormones aren't working right and your neurotransmitters aren't the same, you can just look at a list and know what to do. You don't have to try to think your way through something when your brain's not working.
Totally.
I think that's huge.
Yeah. And feel like there's something wrong with you, because again, people go right back to this idea of like, if my brain isn't working how I want it to work or how I'm used to it working, I'm doing something wrong.
Yeah.
I need to make a different decision or do something differently, when again, that's not always the case, not usually the case.
Yeah.
Yeah.
Absolutely. Yeah. So I know, like, you were also talking about kind of like availability of resources, and I know you've specifically chosen to make your practice entirely virtual so that you do have more availability to people. And I think you even told me a story one day of someone who like needed to take the call with you in their closet because they had so much going on at home.
Yeah.
And you know, it's especially like if you're postpartum or something, like you're not really in the place where you want to leave your house and go drive on the highway and like all of that stuff. So I'd love if you could talk a little bit about what you think the benefits are to not only patient, clients, and practitioners from this approach, but yeah, just why do you feel it's the best option?
So, Christina, as you know, I'm a huge proponent of virtual care, and it gets me in trouble in lots of therapist circles, because lots of people say, you know, virtual care doesn't work. It's not effective for therapy. It's harmful. We shouldn't be using it. And I 100% disagree. I believe there's so many reasons why virtual care to me is the best way to remove barriers. You know, there's so many barriers with attending a therapy appointment or any appointment in person, particularly during the postpartum period, but I think during other periods as well. And we know with moms, with women in general, the first thing to go when people are feeling stressed or overwhelmed is anything that's for themselves. And postpartum women feel stressed and overwhelmed almost always. I might even like venture to say always. And when they're struggling, the idea of attending therapy is already just a barrier. Packing up babies and getting them out the door. We always, you know, I had a bricks and mortar practice, and I always welcomed babies. And the idea in theory is beautiful, except that babies only stay babies that don't move for so long. And then having a 9-month-old or a 10-month-old in your therapy session is probably the most distracting thing that you could ever bring on. I can have as many toys as I want in my office. It actually doesn't matter, because they just are needy. They want to touch things. They want your full attention. So
the same thing in practice with people who are like face down on the table and they like literally get up to go do something. It's just, you can't be separate from it.
You can't. So it's that's a big one. You know, I had a client in my bricks and mortar practice who, she would book an appointment at 4:30 so that she could meet her husband at my office on his way home from work. He could take the minivan with the kids and get home, and she could come into therapy. And one day I watched her drive in, like the minivan roars into the parking lot, into a spot. Her husband's late. They're like having an interchange in the parking lot, swapping cars. She's running in frazzled. And we have to spend 20 minutes like regulating her nervous system before we can even dive in. And what a waste, what a waste. Virtual care to me offers flexibility. It offers increased confidentiality. Clients who spend our hour together crying don't have to worry about walking out through the waiting room and seeing the next client there. Maybe knowing them because people live in small communities. And if not even, it's still, you don't want to face people sometimes. You just want to have your experience and go home. They can sit, our clients that we see virtually can sit on their favorite couch with their favorite blanket with a cup of tea. They can have babies, toddlers, older kids in the background with snacks, with TV, whatever it takes to get through. Yes, I've seen women hovering in their closet to find some space, in their shower stall, in the parking lot at Starbucks, wherever they can find space. Also, women who go back to work, well, before we offered virtual care, we would see people throughout their maternity leave, which in Canada we have 12 to 18 months. For you guys, it's a lot different. And they would go back to work and therapy would just drop off because it was already enough to balance, too much to balance. So they couldn't take care of themselves anymore. So virtual care, I think, removes all of those barriers. It also allows clients to access the right therapist or the right clinician or practitioner who specializes in what they're facing without worrying about geographic location. So it's broadened. We have clients all over Canada because they're like, we heard that you were the best. You're who I want to see, not just the person in my small town or even in my big city. So for me, I find that that's a huge benefit. People feel more emotionally safe. I've seen it in my clients. In last year, we saw 700 new clients. Two chose to be referred to somebody who offered in-person services instead of virtual. 2 of 700. So I know that it works. I've seen it firsthand in my clients. I had a client once who said to me after a really hard postpartum experience, she was about 1 year past that. And she said, just so that you know, virtual care literally saved my life. You saw me when I was lying in bed with my eyes closed because that's all I could do. If I had to come to your office, I wouldn't have survived. I would have taken my own life. I never would have accessed therapy. And that enough to me, that one person is enough for me to say virtual care can be a really effective tool, and it helps us to reach people who we wouldn't otherwise reach. I really believe that it's such a great way to reach and support our clients, and it's a great way to take care of ourselves as practitioners as well. Virtual care offers, I never wanted to be the clinician who sat in front of my clients completely burnt out, thinking of all the things I had to be doing or all the things I had to juggle. And it's great now. I can show up for my kids and be present in their lives for the school meeting or whatever happens in the day to day. And I can hop back on my computer a few minutes later. I can pop out for dinner and I can come back and see clients in the evening. I was always opposed to evening sessions when I had an in-person practice because it meant missing the whole evening. So the flexibility it offers me allows me to offer more flexibility to my clients, which again is one more just huge way it benefits both of us.
I love that. And I know you're in your training program, you're also working on teaching people how to have a virtual practice because it is a big transition. There's a huge learning curve, and technology is a thing that we weren't expecting to get like a whole other degree in, but these days when you're learning it, it's like, yeah, you're learning a whole other field. Yeah. But I know that you're teaching people how to create what you call like a lifestyle practice, and you think that it makes better practitioners, which I think that lifestyle balance, exactly what you were just talking about, prevents practitioners from draining themselves, because that is a reality of being in practitioner care. Is, I think, understanding your own boundaries is a whole learning process in itself, and no one can really tell you that. Like, you have your legal ones, but your personal ones and what your personal capacity is something that you have to learn for yourself. And I think a lot of us end up hitting a wall at some point in that learning process. So I'd love if you could talk about what you view as a lifestyle practice and the things that you're working on teaching people to foster this.
Yeah, absolutely. So I totally agree with you. When I first started my practice, I had literally no idea what it would take to build a business. I was completely underprepared. I was taught nothing about business in my graduate program at all. Everyone I talked to had the same experience. It's like, here's all the clinical pieces to learn. Now just go run a business. So I dove into everything, you know, business training, coaching,
The
mastermind groups,
spiritual
mentorship.
journey.
Huge. And I quickly learned through all that how much I actually didn't know and how much I had to self-teach. So I, you know, fast forward a number of years, a few now, and my practice has grown immensely since moving to virtual. So I was on my own as a solo practitioner. When I moved to virtual, I hired 17 clinicians in 3 years. 12 of those were in the first year and a half, because that's how far our reach went. That's how much this worked for people. I really believe that we have to practice what we preach, which is why creating a lifestyle practice is what made sense for me. It's allowed me to meet my own personal and family goals. I now live in Costa Rica and run my Canadian practice from here, which it was a dream that was like this far-fetched dream. We thought, you know, this is the dream that we have that will never actually come to fruition. But building a lifestyle practice where my practice works for me and I'm not just burnt out all the time trying to make it work has really changed my life in all aspects. So I feel passionately about trying to help clinicians to increase the time and energy that they're, you know, that they're putting out all the time to also benefit themselves and not just be pouring everything into creating a practice that they then feel so overwhelmed and burnt out by. I want them to be able to have both, like to have a practice and work that they love and they're lit up by and inspired by, and to be able to take that and live wherever they want and sort of fulfill their own dreams outside of their practice and have those two things work together. So yeah, I've spent the last year really diving in and trying to figure out how can I use all of the lessons that I learned to create a highly successful, fully virtual practice to help other clinicians to do the same. I want clinicians to be able to show up for their clients, feeling inspired, feeling excited, feeling full of joy, because it matters and it really impacts our work. And I love my clients. I never want to refer them to clinicians who are burnt out, sitting there and not able to really be present. So I really, you know, I'm aware that the best way we can show up for our clients is to safeguard our own physical, mental, emotional well-being. And I think that having a lifestyle practice that works for the clinician is really the key to doing that. So I've actually just launched this week a mentorship group for practitioners and clinicians, Bloom Virtual Practice Mentorship, how to create the lifestyle practice of your dreams. It's a 12-week mentorship program. It's in just the beta phase, so the price is really low. I typically charge for a 2-hour business coaching session $500, and I just launched this 12-week group for $997 because I really want to just, my goal is like, how do I just reach practitioners? How do I get more people to feel the way I do about my clients and my practice and my business? And how do we just not keep rewriting the script? You know, I have a proven methodology. I've dug in and done the work to figure out how to make a virtual practice successful. And I really feel called to share that. So that's kind of my newest offering. It's open to any clinicians or practitioners, whether you're in the perinatal sphere or not. It doesn't really matter anybody's niche. We're really just working on how to pivot or grow your virtual practice, how to sort of strategically market to clients who need you, really, and help them to find you, because I believe that clients are there looking for us. We just have to figure out how to make sure that we're accessible and available, and how to scale and operate a group practice if people want to do that. So it offers live coaching calls, a private WhatsApp chat with lots of access for Q&A. And my goal is, like, in 12 weeks, have a really thriving virtual practice that I can refer to, essentially, because I know that people are feeling balanced and healthy in all aspects of life if they offer virtual care.
Well, and I think the group component of it is also huge, because then you're also getting basically a network of friends.
Yes.
And business entrepreneurial practitioner life can be super lonely.
Totally.
And it's hard, like doing it all on your own and holding a container for everybody that you're caring for and trying to make all of the back end business admin things work and still try to take care of yourself.
Totally.
So having some kind of group support, and then you're building your referral network, because I refer to people all the time. Like, I love what I do. I'm the right fit for some people. Some people need more care. And I'm so grateful for the different groups that I've participated in, so that I have a referral network that I actually trust. And it's not just like some random person that I'm searching who might be completely burnt out and resentful themselves. So
Totally.
it's like it allows me to find people that I'm actually congruent referring to and I've met and I can explain. And that's like, it's one of the other reasons I love doing these talks is because then, you know, if I'm referring someone your way, I can be like, oh, here, you can get to know her through this talk. And so it's a really wonderful way to start to do all of those things, you know, build your community, help people know how to find you, help people know how to find other people while having friends and support at the same time. And remembering that, you know, building your business and your dream is supposed to be fun and not
Supposed to
completely
be, right?
stressful. Yeah, exactly.
Completely. Yes. No,
Beautiful.
I
And
totally agree.
for you, I believe you work mostly with clients in Canada, and that's your whole team as well, correct?
We do. So that is our clinical practice. So we can see clients across Canada. Practitioners that I work with can be located anywhere. So yeah, clients in the States, Europe, anywhere else, or clinicians, sorry, are totally welcome. It's just our client base is, you know, clinically we can see people across
And then you're
all
building
Canadian provinces.
your referral network across the world, which I love doing because like I had somebody in Europe reach out to me and I was like, hey, I can't do that, but you know, here's somebody that I
I
trust.
know somebody who can. Absolutely.
Yes.
Absolutely. And I want to say that too, that if there's anybody here that, you know, is looking for a clinician, a mental health therapist to refer their patients to, even if we can't see them because they're not located in Canada, I'm always available. And part of my goal with like advocacy efforts is please just email me. I will help you kind of connect with anybody who does have certification or training. You know, one thing to look for if you are referring patients to a mental health clinician during this period of life is make sure that they are perinatal mental health certified, and they will say that if they have that certification on their website or elsewhere. And I would sort of steer clear of anybody who doesn't have that certification because it does exist, and it really shows that there is some comprehensive learning and awareness of this period of life and how to treat this population.
Makes a huge difference. And, you know, even in the training that I did, like, yeah, there's a lot of ways to approach stuff, but we learn about ways to not do things
Yeah,
in that coursework. And then I still see other practitioners doing those things just because they haven't been through the same coursework. Or, you know,
totally.
it's like they just don't know this about this particular developmental period and that like that kind of thing is not appropriate at this time because of this specific thing. So it's like
Right.
those little nuances that you learn about that I think are really important. Um,
Agreed.
Man, we could talk all
I
day about this stuff.
know. I
I
know.
also like if there's just anything that you wanted people to know and that you really wanted to get out into the world, what would you tell them?
I think the biggest is if you are struggling postpartum or during the perinatal period, know that it's not you. With help, you will feel better. And I know that for sure. And there is support available. And if you're a practitioner or clinician wanting to work with this population, what I really want people to be clear on is a couple of things. One, there's lots of training and certification available. So please do your sort of your research. Make sure that you do have both the knowledge, the experience, and the skill set to actually dive in. We can have clients who have a presenting concern of, you know, postpartum transition difficulties. And when we start meeting with them, lots more comes up. And if you don't have that experience, then we could actually be doing more harm than good, first off. So check out courses, check out my course if you're needing something that just is, like I said, a quick deep dive. And also make sure that you're taking care of yourself. So build a practice or pivot to a practice that does work for you so that you can fully show up for your clients and your patients in a way that is like the best version of yourself. It models for them that the importance of taking care of themselves. And we really do have to practice what we preach. So, yeah.
Absolutely.
Yeah.
And if people wanted to learn more about this, they wanted to either work with you as a client or contact you to figure out if you know someone that you could refer them to in their area, or if there was a practitioner that wanted to kind of check out your resources, where would you direct them?
Absolutely. So bloompsychotherapy.ca is our website, and you can find information there around booking with one of our therapists, information around all things that we support. as well as clinician resources. So my course for clinicians is on there. If you're interested in building a lifestyle practice or pivoting to virtual or growing your practice to become a group practice, bloompsychotherapy.ca/mastermind is my mastermind group. Registration's open for 1 more week, and I would love to see people there. There's a few spots left. And I'm happy to answer any questions about resources, about referrals, about clinician offerings. My email is heather@bloompsychotherapy.ca.
Beautiful. Thank you so much. Like, you're just such a wealth of knowledge. I love it.
Thank you.
And, you know, for anyone listening, like, you can also just click on her name and, you know, send a message through Instagram or go to the links that she has listed there. It'll take you right where you need to go. And if you guys have other questions, you want to know more about this stuff, like, this will be posted on my feed. I'll mark her as a collaborator, so it's posted on hers too. Feel free to write in the comments, ask us questions. It helps us get the information out there, and then it helps us know how we can better support you, because that's why we do these. We can always do another one and kind of dive into more advanced topics. So let us know, like, what you want to know and where you need support, and we're here for you. You're not alone. So thank you so much for taking the time. And any last thoughts?
No last thoughts. The only other thing I wanted to mention, I have another Instagram for clinicians specifically. It's Bloom Virtual Practice. So you can reach me through DMs at either account. So I will always be at the other end, happy to support.
Great. Thank you so much, Heather. It was so nice.
Thanks for having me.
Yeah.
Great to see you too. We'll talk soon. Have a great day. Okay, bye.